And this is especially like it's poignant that we talk about cleanups here towards the end of the presentation, because it really is a last resort, and it's not the tool that we grab for it to begin. You can especially see that with the number of the area restrictions that we do implement. And with that said, most of the encampment cleanups are done under the DOTI authority for the encumbrance cleanup, because they do not rise to the level of a DPHE area restriction. In the case of a DOTI cleanup, there is a 7-day posting that is required, and that gives people in a camp 7 days to remove possessions and find alternatives for living spaces, as well as getting connected to services. I just didn't hear that mentioned, and I wanted to bring that up, that there is that 7-day window of a posting for those DOTI cleanups that really does give people time to get put together as much as they are able to be so, but it also to have a chance to connect with services and service providers prior to a cleanup occurring. Next slide, please. So these are complaints regarding encampment conditions received by DPHE. I apologize for the smaller numbers. It looks bigger on a presentation when you're making them. But we number tracking and data management was one of the big reasons why we wanted to create a specific position for managing these complaints.
Okay, let's just point out that this is not a reflection of the complaints. This is a reflection of buttons like on Chris Hines' freaking newsletter, where they've just made it easier to complain. That is all this fucking shows. It's not like all of the NIMBYs all of a sudden like came to the city raising hell. All of a sudden in February, something happened.
Data metrically for keeping track of these didn't really begin very well until May of 2020. So you can see there we go from 44 to 52 to 42. And then we have a spike here in August of 2020. And then we continue there with that spike a little bit to 168, trickles down a little bit, stays in the hundreds, mid-100 range. And then we have this very large spike here last month. And the reason for this large spike is we began working very closely with the early intervention team. And that's a team out of the Department of Safety who are heavily involved in a lot of these connections of services as well. They're made up of fire, DPD, resources, all the resources outlined today. But one of the things that we aligned with them was just they began to forward complaints that were relevant to encampment conditions to us. So it was another avenue to receive complaints. So that is the reason we had such a large spike there. With that being said, though.
So Exhibit A from July to August, man, what happened? Oh, I don't know. Maybe you displaced hundreds of people in the city, and now they're in pockets all over the city instead of being a community that can receive services. And lo and behold, the community notices. I'm just dumbfounded as to why it's so difficult for people to understand that the city did this. The city did this, is doing this.
They are also experiencing a large increase in complaints, as is 311 in general. But these are complaints that are directly related to encampment conditions, specifically through the lens of a public health focus.
Specifically through the lens of a public health focus. That's all.
So that's all I had for my slides. I'm going to pass this over to Danica, but the next slide is just a few photos of some of the encampment conditions that would present an area restriction possibility.
They're literally exploiting the poor to prove a point about how they're traumatically displacing the poor. They're literally like exploiting people that they say that they're helping to justify their criminalization and terrorization of people, the most vulnerable people in our freaking community.
And these all did result in area restrictions. But I'll let Danica walk you through some of the context for that.
Danica.
Thank you, Matt. I want to let everybody know that we struggled a bit with whether we included pictures, because our intent is not to stigmatize.
Well, you've done
It's not to be inflammatory or sensationalize, but we do think it's really important for the board to understand the types of situations where DPHE interventions
the board hasn't seen
may
it with their
occur.
own eyes.
And so what you see on the left is a picture from Veterans Park. There was a DPHE area restriction and cleanup in very late July, I believe. Yeah, it was at the end of July. And that park that was between Civic Center Park and the state capitol had become an area where many people were camping for an extended period of time. There were tremendous amounts of food sources. We had people camping right on these spaces, and the whole park was riddled. Trees had to be removed as when the state park was closed. I went out and spoke with a woman who was pregnant, who we were able to work with the homeless outreach team to connect with shelter service, and she was eight or so months pregnant, and she told me about how she had rats chewing through her tent at night. And so, often what we hear from folks who are
like, are you fucking kidding me? Maybe if you had provided trash services, then the rats wouldn't have had anything to feast on. But instead, you let it get like this, Danica.
Impacted by cleanups. Many of the people understand the reasons why. And have, I am very confident saying that anybody displaced in an encampment that has been there for a while has interfaced with many service workers.
Dave, is that what you hear? That anyone who's displaced has interfaced with many service workers?
Yeah.
Is that what you hear? Like today,
mutual aid.
Did anyone? Yeah, maybe us, but you can either.
To outreach, but that picture on the left was the day that park was cleared and we and the cleanup efforts began. On the right are two pictures from outside of two different service provider facilities.
What did they take out of the picture?
I mean, these areas are serviced with daily trash pickup throughout the weekdays.
I'm sorry. Let's go back and let's listen to that again, everyone, real quick. Just want to make sure I'm fucking hearing you correctly, Danica. Like, are you fucking kidding me?
At night. And so, often what we hear from folks who are impacted by cleanups, many of the people understand the reasons why, and have, I am very confident saying that anybody displaced in an encampment that has been there for a while has interfaced with many service workers working to outreach. But that picture on the left was the day that park was cleared and we and the cleanup efforts began. On the right are two pictures from outside of two different service provider facilities. And you can see, I mean, these areas are serviced with daily trash pickup throughout the weekdays.
So
our service with daily trash pickup throughout the weekdays.
So at Lincoln Park, because they do the trash pickup across the street at the one trash can.
She's talking about these though. She's talking about this was out front of the Saint. What is it called? What's the shelter? This is out front of St. Francis, and this one might be Maury. It kind of looks like, I don't know what that one is, but. Let's just be clear, there's no daily fucking trash pickup. Like, that's never occurred, ever.
But a lot of the times, folks, some people experiencing homelessness may accumulate a lot of possessions. And so you can imagine that when these...
Danica, let's compare your possessions, your number of possessions, to the number of possessions of someone experiencing homelessness. Let's just put them out. Like, let's get all the things that are in Danica's apartment, all of the things in her car, all of her clothes in her closet. Let's put those out on a lawn like a yard sale. Then let's get the person living on the street with the most possessions we can find, and let's compare them and let's see who has more. What are you betting, Dave? What do you think?
I would say it's not the unhoused.
Yeah, fuck you, Danica.
Situations are occurring in... First of all, whenever they occur, they're impacting the people who are living in those spaces. It is not a safe area to live in. And certainly those impacts do not stop with the people who are living in the encamped space. So we're really trying to provide healthy spaces for everybody.
Oh, really?
Connect people.
Really? Okay, let's just break this down here. So let's not forget that on December 29th, 2020, COVID testing at the 48th Street shelter revealed a 32% positivity rate for COVID. 1 in 4 service providers around that time had or was or currently had COVID. So we're talking 25% of people that are working with people experiencing homelessness had COVID. So she's arguing here that they are putting people, they are, offering and opening the door for people to move into a safe setting. I don't know about you, but I'm not going anywhere and laying my head down, sleeping next to people that has a 32% positivity rate of a virus that is killing people around the world. I'm sorry, Danica, you are literally delusional.
Services and remediate these types of situations and scenarios. And with these 2 pictures on the...
Oh, and I'd take Hep A any day over COVID, just for the record.
We actually had the service provider, the overnight shelter facility, reaching out, imploring the city to help clear the areas off, because often when something accumulates to this degree, it is very difficult for people who need to access the services in the building to get into the building. A lot of times people are intimidated.
She's using
and we heard great thanks from service providers for helping to make the spaces healthier, connect people with services.
Oh, and by the way, this was in April, y'all, of 2021. This is like less than 2 months ago. So she's presenting on encampments that were outside of shelters and the sweep that occurred outside of the Capitol last summer. We know that the nature of these sweeps has drastically and in very important ways changed. The nature of them, how they operate, has changed since then. So she's using outdated examples to justify their all-out war against the poor,
and also make their services more accessible to folks in need. Next slide, please. So I want to talk briefly about CDC guidance, because this is something that's been raised repeatedly. It's been raised in the media, and there are a lot of people and advocates who assert that DPHE is disregarding CDC guidance with interventions, with cleanup interventions, and with those area restrictions. Again, those area restrictions are a small number. They represent a very small portion of the cleanup activities covered by the city. But CDC guidance is generally broad, high level, and singularly focused. And so it's generally, giving guidance for a health agency to kind of adhere to the spirit of. And in this case, with CDC guidance, when the COVID-19 pandemic hit, their CDC did put out guidance discouraging that encampments be disrupted if there were not connections to short-term and long-term shelter and housing services. What I hope that you have heard tonight is that the city and DPHE specifically has been hugely involved in building out services and interventions. Hey, buddy, go ahead in my room. I'm almost done. Sorry about that. And so we really do feel strongly that, we are meeting CDC guidance. Also keep in mind, as I said before, we are not singularly focused. We don't have the ability to singularly focus on the health of a single.
Okay, if you're not singularly focused, then why do you only have one singular strategy for addressing this issue? You rely on one strategy, the sweeps, the traumatic displacements, to manage the community's complaints and to respond to them. And then you have one singular solution, which is a congregate shelter, which during a pandemic or for a myriad other reasons does not work for people. So you're saying you don't have a singular focus, but you do. And you have one singular strategy, one singular solution and offering, and nothing more. I mean, nothing else has been offered on a large scale. There's a here and there. a sprinkling. But you know it just as well as we do, Danica, that what you're doing is not some sort of diverse, creative, options. That's not what's happening. Stop lying to people.
And so when we think about people experiencing homelessness, we certainly very disproportionately dedicate our resources, as we should, to supporting that population. But we also have to.
One sweep can cost $40,000. There are 3 a week. So we're spending hundreds of thousands of dollars, the dollars she's talking about, disproportionately allocating to sweeps. That's what we're giving them to, and to shelters.
About the health and safety of our environment. We have statutory responsibilities, and we want to keep our city safe and healthy for everybody, people experiencing homelessness as well as everybody else.
Well, you're failing at that.
Visits our city and lives and works in our spaces.
How many toes do you have to lose, Danica, to get housing? So who is, you want to respond to everyone. Well, the cost for some people are their digits. Literally their fingers and their toes. I don't think everyone in the city is having to sacrifice that for safety and a place to rest their head at night, are they?
And I think I will leave it at that on the CDC piece and turn it over to Ann. Thank you.
Thank you so much, Danica, and a huge thanks to all the